order. Senator Kennedy is nearby, and we will be underway very shortly. But I've been authorized by his staff to begin the proceedings. I'm going to make an opening statement, and then Senator Kennedy will be able to make his opening statement. We'll then turn to Senator Cortez Masto and Representative Tenny for their statements, at which point we will hold the proceedings for a moment to reset the table and let other witnesses come forward, and then we will move on to the second panel. Senator Kennedy is here now. Good, I will get underway with my opening statement then. Since the right-wing majority of our captured Supreme Court took away women's right to an abortion, we've been hearing repeated horror stories caused by extreme abortion bans. A 10-year-old girl forced to flee her state to get an abortion after being raped. A Texas man finding his wife unconscious in the bathroom in a pool of blood after the hospital refused to perform a surgical abortion to treat a miscarriage. A Tennessee woman forced to give birth to a stillborn baby, knowing for months that the baby was never going to live due to a fatal anomaly. As Senator Murray said at the HELP hearing last week, while dystopian stories get national attention, draconian abortion bans are harming women all over the country. As of today, 14 states have banned abortion, and 3 additional states have banned abortion at 6 weeks of pregnancy when many women do not yet realize they are pregnant. Several more states will have bans snap into place once litigation concludes. Overall, 1 in 3 women of reproductive age live in a state that now bans abortion. For these women, trying to get abortions when needed may mean having to travel hundreds of miles to a safe state. The Guttmacher Institute estimates that in 2023, more than 170,000 individuals had to travel out of their state to seek abortions. The average Florida resident now lives about 590 miles from the nearest provider, adding a drive time of more than 7 hours. OBGYNs and doctors who care for pregnant women have seen firsthand the chaos and heartbreak these bans have wrought on women and families. We will now hear briefly from providers about the toll abortion bans have taken on their patients. The video lasts about 2 minutes. Please proceed with it.
Ever since Dobbs, we are definitely seeing an increasing number of folks traveling to Rhode Island from states where abortion is banned in order to access care here.
I have saved people's lives, providing them with the abortion care that they need.
The people hit hardest by abortion bans are those the least able to take the hit. Young people, people living in poverty, immigrants, Black, brown, and indigenous people.
Abortion bans harm so many of our patients. This means that our patients cannot access the care in a timely fashion. They can't access care when it's safest, which is earlier in gestational ages. It also means that many patients are going to be left without access to standard health care.
What does it mean when it's not by the lack of skilled providers, but by legal limitations that you cannot have your needs met within your community?
I am seeing patients every day from restrictive states.
But that does come with some harms and with some challenges, primarily around cost. People have to pay for the travel. They have to potentially pay for a place to stay. There's time off of work that they may be missing.
Many patients don't have the funds to be able to travel to access the care that they need. They don't have the ability to even know where they might be able to go to get this care.
They often reach our doors later than they would have if they'd just been cared for at home. Their care becomes more costly, and also the procedures carry higher risk.
But it also means that there will be people who simply are unable to surmount those barriers and who end up being denied care because of these bans.
Not only has post-Dobbs abortion care increased financial strains, worsened health outcomes, but it's also weakened the social fabric of our lives.
Limiting abortion leads to worsening the current social inequities that we have in this country, and it is crucial that we ensure that everybody has access to safe health care.
People are being harmed by these bans, and it has to stop.
No one should leave their healthcare provider feeling helpless. No one should have to leave their loved ones and community to receive access to healthcare.
We will hear today from Lauren Miller, who had to flee her home state of Texas to get the abortion care she needed for a non-viable twin. Lauren was sick enough to warrant multiple trips to the emergency room, and her healthy twin and her own health were at risk, but she wasn't near death enough to qualify for an abortion under Texas's ban. When the court announced Dobbs, Republicans claimed it returned the issue of abortion to the states. But they're clearly not content with criminalizing abortion in their own states. They now want to go after anyone who helps women and girls seek care in a safe state. Already, Alabama's Attorney General has threatened to prosecute anyone who helps a woman leave Alabama for abortion care. That could be a doctor who refers the woman to an out-of-state provider, a friend who helps book a plane ticket, or a family member who pays for a hotel. Think of a state prosecuting and jailing aunts and grandmothers trying to help. In Texas, a man is suing to investigate women who allegedly helped his ex-girlfriend travel for an abortion out of state. Although some state efforts have been temporarily blocked by federal courts as unconstitutional, the clear purpose of these attempted travel restrictions is to scare people and sow confusion and fear in the medical profession. Many OBGYNs in ban states do not feel safe referring or even sharing information about abortion care out of state. Ms. Miller will testify that her doctors were frightened to even suggest an abortion for her non-viable twin to protect her viable twin. These legal restrictions prevent OBGYNs from providing the care they're trained for that is medically indicated. So, many are choosing to leave ban states. Bad news for women's health. We could dispel any doubts about the legality of traveling for abortion care by passing the Freedom to Travel for Health Care Act. That bill, sponsored by Senator Cortez Masto, in which I'm pleased to join, protects the right of women to cross state lines to seek abortion services. It would also protect providers and anyone who helps a woman travel interstate for abortion care. As we've seen, we can't rely on an increasingly extreme Supreme Court to protect constitutional rights we've relied upon for generations. Congress needs to step in to limit the damage this court has done. We can start by swiftly passing the Freedom to Travel for Health Care Act and codifying the protections of Roe and safeguarding access to contraception and IVF. I now recognize Ranking Member Kennedy for his opening.
Thank you, Mr. Chairman, and thanks to my colleagues for being here. In 2022, as we're all aware, the United States Supreme Court returned the issue of abortion to the American people. It said to the American people, you decide what's right for your state on abortion, either through referendum or through your elected state representatives. So for the first time in decades, pro-abortion and anti-abortion Americans are now able to meet on equal terms without judicial interference to determine the laws as they see them being best for them, governing the issue of abortion. No longer will Americans have to live under a court-imposed definition. The American people get to decide. Now, that has upset some of my colleagues here in Washington. It was and is the genesis of a very organized effort that you see playing out today to undermine the United States Supreme Court as an institution. I remember it like it was yesterday. My colleague and my friend, Senator Schumer, stood on the steps of the United States Supreme Court. And this is what he said. I quote, "I want to tell you, Gorsuch, I want to tell you, Kavanaugh, not Justice Gorsuch, not Justice Kavanaugh, Gorsuch, Kavanaugh, you have released the whirlwind." He was talking about the Dobbs decision. "And you will pay the price. You won't know what hit you if you go forward with these awful decisions." End quote. Wow. Some people do not want any regulation of abortion. I get that. This is America. You can believe what you want. In fact, some of my colleagues have endorsed a bill. It's S-701. It's called the Women's Health Protection Act. This would allow the right to terminate a pregnancy after viability. Basically, terminate a pregnancy at any time for any reason. The day before a baby is born, a mother could decide to terminate that pregnancy for whatever reason. She doesn't have to give a reason. Maybe she's changed her mind about having a baby. Maybe she's not happy with the baby's gender. But it would be legal. I think every one of my Democratic colleagues on the Judiciary Committee has co-sponsored that legislation. I respectfully disagree with them. Last Congress, Senator Graham had what I thought was a very modest bill. It's called Protecting the Pain-Capable Unborn Children from Late-Term Abortions Act. I tell you what it would have done. It would have limited abortion to 15 weeks, except when necessary to save the mother's life or in cases of rape or incest. Now, we never voted on that bill, but I think most fair-minded people would call that a fairly modest, middle-of-the-road approach. But it was blocked. The American people know how they feel. I can tell you that. And if we will allow them, they will make this decision for themselves. Most Americans, most fair-minded Americans, support reasonable regulation of abortion. Not unfettered discretion, not using abortion for birth control. Reasonable regulation of abortion. I was looking recently at a recent poll from January. 6 in 10 Americans support limiting abortion to the first 3 months. Now, I don't know if that's the right answer or the wrong answer. It's not my place to say. The people of each state get to say. But I'm just telling you, in this credible poll, 6 in 10 say they support limiting abortion to the first 3 months. 6 out of 10 Americans oppose abortion because of a child's Down syndrome diagnosis. 86% of Americans oppose sex-selective abortions. You abort the child because you change your mind about your gender preference. I can't imagine that's not 100%, but 86% is still pretty high. We may hear a lot of rhetoric today about assault, particularly Republicans' assault on abortion and on women's health care. When you hear those words, I want you to substitute what those words really mean. That is that some of my colleagues want to tell the American people from on high exactly what the rules ought to be about abortion in America. And they're so angry. They're so angry at the United States Supreme Court for returning this issue to the American people that they're willing to destroy that court. Now, you don't have to be mental material to understand that that is what this is all about. Thank you, Mr. Chairman.
Thanks very much. I'm now going to recognize Senator Cortez Masto for her opening statement. She is a steadfast champion for women's reproductive rights, and she is the sponsor of the Freedom to Travel for Healthcare Act, which is the subject of today's hearing. And then I will invite Senator Tenny to introduce his witness from the House. Senator Cortez Masto, you are recognized.
Thank you. Thank you, Mr. Chairman, to the ranking members and the members of the SID committee for allowing me to talk with you today about an important piece of legislation that I've introduced, and so appreciate the support of my colleagues, which is the Freedom to Travel for Healthcare Act. This month, we mark 2 years since the Supreme Court overturned Roe versus Wade. And by the way, there were reasonable restrictions in Roe versus Wade. And I think it is important as we move forward, we call out when people are peddling in fear and misinformation and talk about the true facts. Women deserve that. In the 2 years since that decision, nearly half the states in our country have banned or effectively banned access to abortion. Women in those states have extremely limited options for accessing essential health care. For many of these women, their only option for getting the reproductive care they need is going to another state. In the last 2 years, the number of women coming to southern Nevada from out of state to get abortion care has doubled. Like women across the country, I could foresee that the anti-choice movement would never stop trying to dismantle women's rights when they overturned Roe versus Wade. I knew that road being struck down would only encourage anti-choice extremists to continue their crusade to control women. That's why in the aftermath of the Supreme Court decision 2 years ago, I wrote the Freedom to Travel for Healthcare Act and led my colleagues in introducing it. Our legislation reaffirms that women have a fundamental right to interstate travel and makes it crystal clear states cannot prosecute women or anyone who helps them for going to another state to get the critical reproductive care they need. The Freedom to Travel for Healthcare Act would also protect healthcare providers in pro-choice states like Nevada who help these women traveling from out of state. Why is that important? Because even the thought of criminalization by another state has a chilling effect on my doctors in my state and women who want to access 21st century health care. In Nevada, we welcome these women and provide them with the health care they need. Nevada is a proud pro-choice state. Back in 1990, Nevadans overwhelmingly voted to codify a woman's right to choose. And today, over 2/3 of Nevadans believe that a woman's health care decisions are between her and her doctor. The 2/3 of people in my state are made up of all parties. They're Democrats, they're Republicans, they're independents, they're women, and they're men. Doctors and healthcare providers in pro-choice states like mine should never be penalized or prosecuted for helping women access essential care. The Freedom to Travel for Healthcare Act would guarantee they never will be. You know, when I introduced this bill, my colleagues, including some who sit on the subcommittee, said we were overreacting. But in the 2 years since Roe fell, we've seen time and time again that we were not, because anti-choice Republicans in states like Idaho, Texas, Alabama are working to bar women from leaving their states to receive abortion care. I know today you're going to hear from a witness who has her own story to share about traveling for abortion care. Unfortunately, her struggles are not unique. There are thousands of women living in anti-choice states who are being told by their doctors that they have to risk their own lives rather than get the critical care they need. They have no choice but to leave their state and see a provider who can actually help them. That's why we have to pass the Freedom to Travel for Healthcare Act and protect these women's constitutional right to travel to get the care they need. This should not be a partisan issue. I stand with a vast majority of Americans who believe that politicians should have no say in a woman's healthcare decisions. And the United States Senate should be doing everything in our power to safeguard women's rights in every state across this country. Mr. Chairman, thank you, and again, I appreciate you bringing forth the bill to allow women to travel for their healthcare needs and protect the doctors who want to care for them.
Thank you very much, Senator Cortez Masto. I understand that you have a very busy schedule today with many other obligations, so you are free to take your leave of us at your pleasure. And I turn now to Senator Tenny for his introduction of Representative Tenny.
Thank you, Mr. Chairman. Representative, welcome. Thank you for being here. Representative Claudia Tenny is a graduate of Colgate University. She is a lawyer. She graduated from the University of Cincinnati College of Law. She represents New York's 24th Congressional District. She's a member of the House Ways and Means Committee, the House Science, Space, and Technology Committee. She is, as you will soon learn if you don't know her, she is whip smart, and she is tough as a boot. And she knows what she believes. She's thought it through carefully, and she is entitled to those beliefs, as is every American. And I am delighted that she could share some of her time with us today, Congresswoman. Thank you for being here.
Representative Tenny, please proceed.
Thank you so much, Chairman Whitehouse, and thank you for those kind remarks, Ranking Member Kennedy. And for everyone who's a member of the subcommittee, I'd like to extend my thanks, especially for inviting me to participate in this panel today. And as a member of Congress representing New York's 24th District of New York, for those of you who don't know, it basically circles Lake Ontario, the most easternmost lake in the Great Lakes, including the beautiful Finger Lakes and part of the southern tier of New York, probably one of the most beautiful places on earth. And I've always believed strongly in protecting the lives of the unborn and standing up against the radical pro-abortion agenda being pushed by the Biden administration, radical late-term abortion states like New York that actually codified an unconstitutional late-term abortion law even before, beyond the abortion ban that was set forth in Roe. And yes, Roe was an abortion ban up to a certain amount of time. And so let's use our language carefully and use the language to tell the truth here. This Congress, I've spearheaded multiple legislative initiatives aimed at safeguarding and assisting expectant mothers and their children, both born and unborn. Most recently, I introduced the Unborn Child Support Act, which seeks to ensure expectant mothers receive child support payments throughout their pregnancy. I also championed the Supporting Pregnant and Parenting Women Families Act, which passed the House by a vote of 214 to 208. This bill prevents the Biden administration from imposing restrictions on how states utilize temporary assistance for needy families, otherwise known as TANF, funds for pregnancy centers, crisis pregnancy centers. Pregnancy centers are a critical social service organization offering support and comprehensive care for young women to continue healthy pregnancies, the birth of healthy babies, and to deliver pre- and postnatal care to babies and families. These organizations, which are vital to the communities they serve and are commonly operated by faith-based organizations, but not always, are often maligned by radical left-wing abortion groups and are frequent targets of vandalism and often violence. Compass Care, run by Reverend Jim Harden, a wonderful man in my community, and located just outside of my district in the suburb of Buffalo in Amherst, New York, was the target of a firebomb attack that was a clear-cut case of domestic terrorism. I stood with Reverend Harden and the Compass Care team at their grand reopening after this cowardly act of domestic terrorism. We are still waiting for Attorney General Letitia James to prosecute this case like she has so many others where there are not even crimes existing. We have the evidence. They refuse to prosecute. These acts of violence are driven by extremist messaging on the part of radical pro-abortion groups, which are legitimized, again, by the Biden administration, Democrat governors, legislators, including in my own state of New York, where faith-based organizations and other crisis pregnancy centers work diligently to provide care to women, families, and babies in need with genuine support and compassion and health care that all families need to thrive. And if you've never visited one of them, a CareNet or Compass Care across New York State, it's incredible the work they do to bring families together and to keep families intact. Really the point of TANF, I might add. Instead, Democratic governors are more interested in undermining and interfering with the rule of law for states that support life. This includes shield laws that prohibit state courts and officials from cooperating if another state attempts to hold providers accountable for offering abortion advice via telemedicine, or including laws that require parental consent in the case of a minor seeking an abortion. These are minor limitations that are not being recognized by many of these states, these pro-abortion states. These laws also leave women without any type of legal recourse if they suffer health complications from an abortion provided by a so-called shield state provider. Several providers in New York announced that they plan to mail abortion pills before New York even signed its legislation into law, just like New York passed a late-term abortion law well beyond the constitutional limits of Roe versus Wade, long before the Dobbs decision was passed. Several providers in New York also allowed this legislation into law, including one New York doctor who mails abortion drugs from her ping pong table in her basement with no oversight. Protection for women's health is paramount and is important, and that's what we stand for. States like New York have not only passed these laws designed to undermine states that advocate for life in children, but many have also designated budget line items set aside for the purpose of conducting outreach to out-of-state individuals and using taxpayer money for non-resident abortions and what many call abortion tourism. These state-run abortion funds, again, taxpayer money, lack any transparency about the age and the health status of individuals receiving these taxpayer-funded abortions. The funds do not comply with state laws that support life, including the requirement to obtain parental consent for a minor seeking an abortion, even in the case of a late-term abortion. In closing, I want to encourage all of my colleagues to push back on efforts from radical state governors and legislators attempting to subvert the duly enacted laws of other states to serve their own political agenda and put young women and young children and babies unborn as well at risk. This callous attempt to weaponize and abuse institutions undermines the concept of federalism, as Senator Kennedy actually pointed out, and the constitutional rights of every citizen and our shared mission to protect and support mothers and vulnerable children, both born and unborn. And I want to thank you for having me here today. I appreciate it.
Thank you, Representative Tenny. I'm sure you also have a busy schedule, so we will excuse you as well, and we'll take a 1-minute suspension of the proceedings to allow the staff to change the seating and the signs and call up our second panel.
Thank you, Congresswoman.
Thank you.
While that's transpiring, let me acknowledge the presence here of the chairman of the full committee, Senator Dick Durbin. I'm very grateful that he is here, and thank you. We'll get underway very shortly.
So the only senators you have not acknowledged, Mr. Chairman, is Tom Tillis and the junior senator from New Jersey.
Yeah, what have you guys been up to?
Thank you for that. I feel so affirmed.
I acknowledge you, sir.
You got my thing? Okay. How do you say that? Stop.
All right, welcome everyone. I'm going to take a moment to introduce the witnesses for the majority and then turn to Ranking Member Kennedy to introduce his witnesses. Our first witness will be Lauren Miller. She is a Texas native who was forced to travel out of her home state for an abortion after her health rapidly declined. She lives in Dallas with her husband and 2 young sons. She joins us today to share her firsthand experience of being denied the services that she needed in Texas. Isaac Maddow-Zimet is a data scientist with the Guttmacher Institute. Mr. Maddow-Zimet's main areas of research include gathering data on pregnancy statistics, including abortions, pregnancy, desires, and sexual health and behavior. He has published articles in Demography, JAMA Pediatrics, and Population Research and Policy Review, among others. Jocelyn Fry is the president of the National Partnership for Women and Families, a nonprofit organization centered on advocating for healthcare, civil rights, economic justice, and racial equity. A lawyer by training, Ms. Fry previously spearheaded the Women's Initiative at the Center for American Progress, where she focused her advocacy on gender-based discrimination and addressing the Black maternal health crisis. Senator Kenny, to you for your introductions of your 2 witnesses.
Thank you, Mr. Chairman. Dr. Ingrid Skopp. Welcome, Doctor. Dr. Skopp is a graduate of Oklahoma State University. She went to Washington University School of Medicine. She's a board-certified OBGYN. She has 30 years of experience caring for moms and children. She's delivered more than 5,000 babies. That's extraordinary. She now serves as the Vice President and Director of Medical Affairs for the Charlotte Lazier Institute, the Research and Education Institute of Susan B. Anthony Pro-Life America. Welcome, Doctor. Thank you for being here. Professor Carter Sneed. Professor Sneed, welcome. Professor Sneed is the Charles E. Rice Professor of Law at the University of Notre Dame Law School. Great law school. He is also a concurrent professor of political science. He's the director of the De Nicola Center for Ethics and Culture. For the record, Senator Booker tried to get into Notre Dame Law School and was turned down. He had to settle for was at Yale. But he was a great tight end, okay? Y'all need to go back and watch some of his film. Professor Sneed has written more than 70 journal articles, book chapters, and essays. He's the author of What It Means to Be Human, The Case for the Body in Public Bioethics, which was published, I think, in 2020 by the Harvard University Press. Professor Sneed is widely regarded as one of the world's leading experts on public bioethics. His research focuses on issues such as human embryo research, assisted reproduction, and abortion. And I'm delighted he could join with us today. And thank you for being here.
Thanks very much. We turn first to Ms. Miller. Thank you so much for traveling here to share your experience. Please proceed.
Chairman Whitehouse, Ranking Member Kennedy, and members of the Senate Judiciary Committee on Federal Courts, Oversight, Agency Action, and Federal Rights. My name is Lauren Miller, and I live in Dallas, Texas. Thank you for inviting me to talk about how the overturning of Roe v. Wade affected me and my family. Texas's inhumane abortion bans stripped me of my bodily autonomy and kept me from making life and death decisions about my health, my children's health, and the future of my family. My pregnancy was not my own. It belonged to the state. And ultimately, the opinions of Texas politicians and government lawyers completely overrode the medical judgment of my physicians and trampled my constitutional rights to life and health. I was forced to travel out of state for the essential and life-preserving medical care that I desperately needed, an abortion. Several weeks into my second pregnancy, I wound up in the ER following 36 hours of unrelenting vomiting. I was treated for severe dehydration, and just to be safe, they looked at the baby. There is nothing that can prepare you for the shock, terror, and excitement of finding out that you're pregnant with twins. My husband and I embraced this family expansion and immediately began planning. That is, until I learned at the 12-week ultrasound that one of my twins was unlikely to survive. It was shattering. There were so many concerns about his development, including the most devastating diagnosis. Half of his brain was filled with fluid. We went through more testing, more ultrasounds, and the news only got worse. Our amazing medical team kept arriving at the same awful conclusion. One of our twin sons was going to die. It was just a matter of how soon. And every day that he continued to grow, he put his twin and myself at greater and greater risk. The answer should have been simple. I needed an abortion of one twin to save the other and to save myself. Before Roe fell, I would have been able to get that procedure in Dallas, in my own community. But because of Texas's new abortion laws, every single medical professional we spoke with told us the medical care I needed was illegal in Texas. They were terrified to even suggest an abortion for the twin that could never survive. The most helpful and direct information we received came from a doctor who was so frustrated with the situation that after one of our most devastating ultrasounds, he ripped off his gloves, threw them at the trash, and told us, "This baby isn't going to make it to birth. I can't help you. You need to leave the state." Only days later, I ended up in the ER again, so sick that I feared the placenta would detach and I would bleed out. I was dehydrated and shaking uncontrollably as the ER team worked to stabilize me. I was at risk of organ damage to my kidneys and brain, but I still wasn't dead enough for an exception for the abortion care in Texas. An abortion was the best chance we had of saving our other son and preserving my health. Yet there were no options, there were no next steps. We had reached the point where healthcare ends in Texas. I was going to have to flee the state where my family has lived for 8 generations. And I was terrified. Now we had to scramble to navigate the logistics of traveling out of state for an abortion. The bounty laws in Texas had us worrying about who could turn against us. Was it safer to attempt 12 hours in a car through rural Texas while I was violently ill? What if I got worse? We knew flying was faster, but what if I was pulled out of the security line and questioned, or not allowed on the flight because I was too sick? Should we leave our cell phones at home and rely only on cash to prevent being tracked? Exceptions to abortion bans are a fiction. They don't exist in Texas, and I am living proof of that. 2 weeks ago, the Texas Supreme Court issued a ruling in Zurawski versus Texas, a lawsuit brought by me and 19 other women denied vital abortion care in Texas, despite facing dangerous pregnancy complications. The highest court in my state refused to provide the clarity patients and doctors need on exceptions. They only said that abortions are not permitted in situations where the fetus has a lethal condition and will not survive, unless the pregnant person is also facing an imminent life-threatening condition. Where does that leave Texans like me? My life was in danger, so was the life of my now healthy son. 18 months later, and I still wake up in a cold sweat, terrified by nightmares of being hunted down. Being pregnant is no reason to be stripped of our human rights to health, life, and liberty. We need federal protection for abortion care right now. This subjugation and dehumanization of women needs to stop. Thank you, and I look forward to your questions.
Thanks very much. Let me turn next to Professor Sneed. I'm going to step out and vote because votes are ongoing. Senator Booker will have the gavel until I return in 10 minutes.
Professor, you may proceed.
Thank you. Good afternoon, Chairman Whitehouse, Senator Booker, Senator Kennedy, and thank you all for inviting me today. When the Supreme Court decided in Dobbs that the Constitution does not preclude the people from governing themselves on the fraught question of abortion, It brought us into alignment with nations around the world who have always addressed the issue through the political process, most of whom restrict elective abortion between 10 and 14 weeks of pregnancy. After nearly 50 years of being deprived of the authority to meaningfully govern ourselves in this domain, the current political and legal landscape is widely varied, complicated, and changing. But American federalism allows for pluralism on vexed questions. Some states have extended basic protections to the unborn, others have moved to eliminate any limits, and some, including this body, have declined to enact laws requiring equal protection for newborns who survive abortions. I would like to respectfully make 4 suggestions for good governance in this difficult area. First, it's important to be clear about the complexity of the matter and to give full weight to all the elements at issue. It is not simply a variation of the healthcare debate. Only 7% of OBGYNs in private practice provide abortions. Nor is it reducible simply to the values of equality or bodily autonomy for women facing serious burdens on their health and future. Rather, the issue challenges us to consider how these goods stand in relation to the life of the unborn child, a whole, living, distinct member of the human species who, if all goes well, will move herself along the trajectory of development from embryo to fetus to newborn, provided she has the necessary support and sustenance in her mother's womb, the first place of belonging for every human being. She is not a trespassing stranger. She is the biological child of this particular mother and father. Our public debate is impoverished when those who support abortion rights fail to acknowledge this reality. On the other hand, our discourse suffers when pro-life officials fail to address the sometimes crushing burdens of unwanted pregnancy and parenthood. To govern ourselves wisely, justly, and humanely, we must begin by articulating the problem in its full complexity without question begging or refusing to consider every interest at stake. Second, our lawmakers must be clear about what limits, if any, they will countenance on elective abortion. There are 10,000 late-term abortions, that is post-viability abortions in America every year, more than 6 times the number of annual gun homicides for children and teens. At least 148 U.S. clinics provide them. Social science evidence and the statements of late-term abortion providers themselves, such as Warren Hearn, suggest that these are frequently not limited to cases involving health risks to mothers or a diagnosis of fetal abnormality. Third, we must fairly and accurately characterize the legal landscape. Every state in America allows abortion to save a mother's life, and the vast majority allow it for lesser health risks. Texas law allows abortions where, in a physician's reasonable medical judgment, a mother has a life-threatening condition that could cause substantial bodily impairment. This is a well-familiar standard that operates in multiple legal contexts, including abortion. The Texas Medical Board is developing clinical guidelines in this area. Texas just passed a bipartisan law clarifying that pre-viable premature rupture of membranes falls under the health exception, and treating an ectopic pregnancy is not considered an abortion. Miscarriage management is also not restricted by law. The Texas Supreme Court just affirmed that serious health risks need not be imminent to justify abortion, and that any clinician who says so is, quote, simply wrong in that legal assessment. That's the Texas Supreme Court's quote. Some recent media stories involve women seeking abortions because their unborn child received a heartbreaking diagnosis of disability or terminal illness. Texas does not authorize abortions solely because of an unborn baby's disability or poor prognosis. Texas also extended postpartum Medicaid coverage from 6 months to 1 year, allocated $165 million to support mothers, babies, and families, and passed a recent maternal mental health law. Fourth and finally, I invite members to reimagine the human context in which the question of abortion arises. Instead of a zero-sum conflict among strangers over the permissible use of force, think of it instead as a crisis facing a mother and her child. Then ask how we can work together across our differences to come to their aid, not just during pregnancy, but throughout life's journey. Thank you.
Thank you, Professor. Mr. Masto-Zimet.
Chairman Whitehouse, Ranking Member Kennedy, and members of the committee, thank you for the opportunity to testify today. My name is Isaac Masto-Zimet, and I'm a data scientist at the Guttmacher Institute, a research and policy organization committed to advancing sexual and reproductive health and rights worldwide. As a core component of its work, the Institute has been measuring numbers and rates of abortion in the United States for half a century. The very first census of abortion providers we conducted was in 1974, just a year after the Roe v. Wade decision, and our estimates are widely considered the most complete counts of abortions in the US, including by those opposed to abortion rights. I have worked at Guttmacher for over a decade. And during that time, my research has largely focused on abortion measurement in the US and globally. Most recently, I've been leading a project called the Monthly Abortion Provision Study, which produces monthly estimates of abortion incidents, travel across state lines for care, and other key data points in order to assess the impact of policy changes related to abortion at the state and federal levels. These policy changes have been substantial and have resulted in a deeply fractured landscape of abortion access in the US. Since the Dobbs decision, 14 states have completely banned abortion with limited exceptions, and many others have restricted abortion access on the basis of gestation or added other obstacles to accessing care. At the same time, in many other states, there have been substantial investments to increase access and protections for abortion patients through state policies, new modes of care, and increased financial support. There have always been substantial barriers to abortion access, even under Roe. Now more than ever, however, access varies widely based on where people live and what resources they have. As a direct consequence of this fractured policy landscape, we have seen dramatic increases in the number of people traveling across state lines for care. In 2023, we estimate that approximately 170,000 people traveled across state lines to access abortion. This represents 17% of all abortions provided in states without total bans, and is more than double the number of people who traveled across state lines for abortion care in 2019 or 2020, the most recent prior years of data available. These increases have been particularly sharp in states bordering those with total bans. In Illinois, for example, the proportion of people traveling from out of state for abortion care increased from 21% in 2020 to 41% in 2023, representing an estimated 26,000 more people traveling into the state to access abortion. Many of these patients are traveling from states with total bans in the South and Southeast, where, because there are very few states in the entire region where people can access care, residents sometimes have to cross multiple state lines and travel many hundreds of miles if they want or need to access abortion care in person at a clinic. These distances have only increased with the implementation of Florida's 6-week ban in May, as Florida, post-Dobbs, had become one of the main points of access for abortion care in the Southeast. It's important to note that even when people are able to access abortion care by traveling, this travel comes at enormous cost to many who are already bearing the brunt of inequitable access to care. It comes at financial cost, the cost of the abortion itself, the cost of travel. It comes with a logistical cost, finding a place to stay, arranging for childcare since most abortion patients are already parents, being able to request time off work. And it can come with an emotional cost, navigating an incredibly complex and quickly changing legal landscape in order to access care that is an extremely normal and common part of people's reproductive lives. Often the only way that people are able to overcome these costs is with a lot of support from providers, from abortion funds, and from broader support networks. Because the costs of travel are so high, we know that many people are not able to overcome them, and that the impact falls especially hard on those who already face the biggest barriers to healthcare: Black people and other people of color, immigrants, young people, LGBTQ+ folks, and people with fewer economic resources. Some unable to travel are able to access abortion care online, even in states with total bans. Many others are forced to remain pregnant when they don't want to be. The bottom line is that Dobbs has created a patchwork of access to abortion care that denies people their reproductive freedom. No one should have to travel to another state to access basic health care. People deserve to be able to access abortion care in their community, using the method they want and in the setting they want. Until then, it's critical that we protect people's right to travel for care and assist others in traveling for care, as well as advance policies that provide the sustained support and infrastructure to make that travel possible. Thank you so much for your time.
Thank you very much, Mr. Masto-Zimmet. Dr. Skop.
Good afternoon, Chair, Ranking Member Kennedy, and esteemed members of the Judiciary Committee. Thank you for the opportunity to testify today. As you've heard, I am a board-certified obstetrician gynecologist from Texas, where I've cared for women and babies for over 30 years. Like approximately 90% of obstetricians, I do not perform abortions. This hearing seeks to address interstate travel for abortion after Dobbs. Women retain their constitutional freedom to travel within our country for any reason they wish, including to obtain elective abortions. I would like to address the issue of care, a word we've heard several times today already. As an obstetrician, I have been privileged to care for 2 patients, balancing the needs of both mom and baby. My care remains unchanged since Texas began protecting unborn life. We hear frequent claims that pro-life laws prevent care of life-threatening pregnancy complications, requiring women to travel out of state. This is false. All state laws allow doctors to use our reasonable medical judgment to determine if an abortion is necessary in an emergency. As an experienced obstetrician, when I evaluate a patient, I use my clinical skills backed up by guidelines from my professional organizations and the peer-reviewed literature to diagnose a complication that may become life-threatening. I and my peers know what these conditions are, even if we cannot predict with certainty whether that complication will cause a woman to die or how quickly harm may occur. No state requires immediacy or that a woman be dying before we can intervene, and the Texas Supreme Court has twice affirmed this fact. And of course, laws protecting unborn life never prohibit care for a woman who has tragically suffered the death of her unborn child in a miscarriage or stillbirth. It is the intentional lying and fear-mongering about these pro-life laws that confuses physicians and puts the health of women at risk. Surveys demonstrate that the majority of women with a history of abortion would have preferred to give birth if they'd only had more financial and emotional support. Sadly, nearly a quarter of these women describe their abortion as coerced or unwanted. How many of these women would now be raising their children if they had been offered true care and support? If they had not been pressured to abort by their partners, families, even by their own physicians? Fortunately, there are nearly 3,000 pregnancy centers in our country providing free ultrasounds, medical services, education, emotional, material, and mental health support, and relationship counseling, supporting women through every step of pregnancy and often long after their children are born. States with pro-life laws have also generously expanded funding of broad social support networks, addressing women's problems directly through housing, substance abuse treatment, financial assistance, and many other forms of needed care. Unfortunately, I have often seen my patients provided substandard care when they choose to travel out of state for an elective abortion. They are steered toward abortion drugs rather than surgical abortion, even though complications occur 4 times as frequently from drugs. They are told deceptively that these drugs are safe and effective, when the FDA's own data documents that approximately 1 in 25 women will have a complication requiring an emergency room visit. The FDA maintains its 2 strongest safety precautions on mifepristone, a black boxed warning and a risk evaluation and mitigation strategy, because they know these drugs can be dangerous. There is often no in-person pre-abortion testing with ultrasound, physical examination, or labs, leaving women at risk of an undiagnosed ectopic pregnancy, underestimated gestational age, future infertility or pregnancy complications, and even coercion by an abusive partner. Women are left alone in their trauma, often seeing their aborted child's body, with only our overworked emergency room system available to care for their frequent complications. Unfortunately, the shield laws of many states protect abortionists from being held accountable when their actions harm women. Our nation has endured more than 50 years of the failed experiment of offering abortion as the solution to women's problems to the detriment of women, children, and families. Women need us to do better and offer true solutions to their unique challenges, rather than defaulting to the violence that ends the life of their children. Women deserve Hippocratic physicians who seek to protect their lives and the lives of their unborn children. In this Dobbs era, our country has a chance to turn in a different direction, to return to the belief that children are a blessing, not a burden, and that women are strong and courageous enough to bring forth the next generation of children. As a doctor who has spent my entire career caring for both of my patients, mom and baby, I know that we can offer them real care and support. Thank you.
Ms. Fry, over to you. Your full statement will be made a matter of record. You're recognized for your oral statement. Thank you.
Thank you, Senator Chairman Whitehouse, Ranking Member Kennedy in his absence, and members of the committee. I appreciate the opportunity to appear on behalf of the National Partnership for Women and Families. We are a policy and legal advocacy group that has worked for more than 50 years to improve women's lives and to ensure that gender is never a barrier to anyone's opportunities or success. We believe that guaranteeing meaningful access to reproductive health care, including abortion care, is a vital part of creating a quality, reliable system of health care that extends throughout a person's life. Access to abortion is essential health care and should be clearly understood as a basic human right, because reproductive freedom is fundamental to upholding the individual autonomy of all women and their ability to control their own bodies. The overturning of Roe v. Wade has been devastating and chaotic for both patients and our healthcare system. When we consider all the states with severe abortion restrictions in place or pending, more than 36 million women of reproductive age are either currently banned or likely to be banned from accessing abortion in the states where they live. This means more and more people must travel further to access care. No one should have to travel to get the health care that they need or face additional burdens if travel is their only option. In some states, lawmakers have contemplated or tried to enact policies that would effectively prohibit residents from crossing state lines to receive abortion care. These efforts are highly problematic, inconsistent with longstanding constitutional protections and Supreme Court precedent, and would bring even more disruption to our healthcare system. The new healthcare landscape and the lack of abortion access has already erected hurdles to obtaining care. Some providers have stopped practicing in certain states, while some hospitals have been forced to cut back services in their maternity units or even close them entirely. Nearly 1 in 3 counties in the U.S. is now considered a maternity care desert, meaning they lack access to a hospital maternity care facility, a birth center, an OBGYN, or a certified nurse midwife. Some providers report that patients must now wait 3 months to receive prenatal visits or ultrasound appointments and sacrifice their time, money, and job security to travel for care. This occurs while maternal health rates in our country already lag far behind many industrialized nations. The maternal health crisis is especially severe among Black and Indigenous women, as maternal mortality rates are 3 times higher among Black women than white women. Abortion restrictions only deepen the inequities in our healthcare system. The costs of traveling for care are significant. They can include gas, food, hotels, taking time from work, or losing a job altogether, and childcare or caregiving costs while a patient is away. These costs often fall on those who can least afford them. Research shows that people who must travel the farthest to access abortion care also tend to earn less income. For example, of the nearly 7 million Black women of reproductive age living in states that have banned or are likely to ban abortion, nearly 3 million of them are economically insecure. The economic hardships now having to travel for care could put the care that they need essentially out of reach. Travel bans also create steep hurdles for disabled women who may need to navigate mobility challenges and to bear the added expense imposed by accessible transportation services when trying to secure abortion care. These efforts to control women's bodies, their choices, their opportunities, and their trajectories in life are not new. The willingness to take away individual freedom and access to abortion, often imposed by people who are disconnected from their lives, is not fair. And too often it is rooted in longstanding stereotypes about gender roles and responsibilities, race and gender bias, and whether women can participate fully and equally in society and chart their own course. Any woman, indeed any person, should have the right to travel for health care, and this right to travel must be protected to ensure that all people can access essential care whenever they need it. I'm grateful for the chance to speak with you today and happy to answer your questions.
Thanks very much. Let me start by asking Ms. Miller a bit more about the circumstance that she faced. At some point, you discovered you were having twins?
Yes, that's correct. That was very early on in the pregnancy during my first ER visit, right around 6 to 8 weeks.
And at the time, were you aware that one of the twins might have a health issue?
No, the opposite. They looked healthy to us. We immediately started planning for a bigger family, bigger car. I had paint samples, whole new registry, was getting a twin nursing pillow, all the gear.
Yeah. When did you first become aware that one of your twins that there was a health concern? Let's put it that way.
It was when we were there for the 12-week scan, and we saw large fluid masses on the ultrasound, and it was a sobering experience. I remember the tech leaving the room, and I knew. I turned to my husband, I said, they didn't do this with our first. Something's not right. And from there, we went through then, over the next few weeks, series of additional tests.
And what you learned was at some point that one of your twins was not viable and would not survive the pregnancy?
Correct. He had a long list of fatal diagnoses, but honestly, I think I can start and end with the first thing we had learned, which was that half of where his brain should have been developing was just fluid. I'm not a doctor, but I don't need to be a doctor to know that you can't survive with that.
Where were you when you heard that, and who was with you?
So my husband was with me. We were at an ultrasound at our doctor's office in Dallas, and it was just heartbreaking. I mean, we were far enough along. We'd been making plans already.
Yeah. And you had obviously some real concerns about how to deal with that.
Correct. We had a lot of concerns because I was so sick at the time. To give an idea of just how much I was throwing up constantly, I didn't reach my pre-pregnancy weight until I was 27, 28 weeks pregnant, in my 7 months. I was just so sick at the time, and all that anyone could say, and we talked to multiple doctors, multiple nurses, multiple genetic counselors, was that this unviable twin was putting his healthy twin and myself at greater risk.
And as that information began to come in, you were depending on your medical team to help guide you through that?
Yes, that's correct.
Was your regular OBGYN involved, for instance, people that you knew and trusted?
Yes, so she was involved, and she'd been my OB for years. She'd already gotten me through my first pregnancy, as well as many others. The way that the hospital works is to give you a chance to meet more than just your normal treating OB. So large team who I knew and trusted.
Did there come a time when you began to feel when you could not entirely trust your own medical team because of concerns that, or for whatever reason, but presumably because of concerns that they had about complying with the Texas law?
It wasn't a matter of trusting them or them trusting me. We would be in these appointments and they would get halfway through a sentence and then just stop, scared because of what the laws meant and how the laws of the state were just haunting these hospital room visits. And it wasn't their fault. They would pause and then just say, "I'm so sorry, I can't say anymore." The closest one came to getting close to suggesting an abortion was she mentioned that when she used to be a genetic counselor in New York, they would have done a single fetal reduction in our scenario, or recommended it. And that was it. She clammed up. You could just feel the fear coming off of her because of where the laws are in Texas.
So you're counting on them to get you through a very, very difficult circumstance for you, for your husband, for your family, and you begin to realize that you're not getting the complete information that they should be giving you because of this law. What were your feelings about that at the time?
It was devastating. The hardest part of finding out that we were going to lose our son and that our healthy son was at risk and that I was at risk should not have been scrambling to get basic information and figure out what we could do.
Thank you very much. I think at this moment, Senator Welch is the senator present, as everybody else is gone and voting. So let me turn to Senator Welch.
Thank you very much. I want to thank the witnesses. And I'm just amazed at what you had to go through. I think it's devastating the Supreme Court stripped women of a constitutional right. I can't remember a court that has been so bad since the Dred Scott decision by Roger Taney. Roe allowed people to make their own decisions, and people have a different point of view on this. Dr. Scott, I take it that you are opposed to abortion.
Yes, it's a human life, and I support human life.
Right, and I respect your right to advocate for that position. But when we had Roe, that could be your position. But Ms. Miller, who had to make a real-world decision about her own life, and probably more importantly, your viable son, had a right to make her decision. And you laid out, when I was listening to your presentation, a point of view that the laws that have been passed in these states that are to your liking, I take it, don't cause doctors to hesitate, that don't create travel burdens on folks who are pregnant. That's certainly not the evidence that I'm familiar with. And I can only imagine what it was like for you, Ms. Miller, to be sitting here hearing that when your very recent life experience was totally the opposite. You couldn't even get basic medical information because providers you trusted and relied on felt they could be on the wrong side of the law. Is that pretty much it?
That's correct. And we would end up in these conversations where they were apologizing to us for not giving more information, and we were apologizing for even asking.
Right. The other thing, Dr. Scope, that you mentioned was that there are a lot of services for folks who may have wanted to terminate a pregnancy but gave birth, and there'd be services for housing and so on. That's not my experience. And frankly, I have a somewhat cynical point of view about some of that advocacy because it's not real. And it's as though the folks who are promoting that are committed to providing protection from conception to birth. But after that, you're on your own. The state of Vermont is very proud of our medical center. And we're seeing, and Vermont has not restricted the right to access to abortion. In fact, it has protected it in our Constitution, so women can make their own decision. But we're seeing in our own health center increasing applications. And what I'm told is that the reason for increasing medical applications is that physicians, or would-be physicians and nurses, do not feel that they will be hamstrung from being able to give the best advice to their patients. And I'll ask you, sir, if that's consistent with the statistics that you found.
Yeah, I think that Yeah, absolutely. I think that in general, access to abortion care and finding providers that patients can access has always been very difficult in the U.S. And now in states, when there are states with bans, that access has gotten a lot worse. It's no surprise that providers want to practice in states where they can provide the best care possible. And patients on their sides are forced to travel very far in order to access that care.
Right. And in Texas, you mentioned the bounties. I mean, they have a law where if they report that you got in your car and went across state lines to get an abortion, they get, what do they get?
I believe it's $10,000 that somebody could basically win for hunting us down. And that would be for my husband, really. So him helping me through the airport, him, helping me to find this information. My husband shouldn't go to jail for trying to save my life and make sure that there is still a mother to our son who was already present, our toddler, or that we could even bring our healthy, viable twin into the world.
Well, thank you very much. My view here is that quite to the dismay, maybe even of the Supreme Court, by turning this back to the states, it created confusion, doubt, uncertainty, anxiety, and a lot of suffering, where we had under Roe the right of folks who were pro-life using their term, and pro-choice using another term. They could each make their own decision, but one side couldn't make the decision for the other. And it's, I think, a grievous miscarriage of justice by the United States Supreme Court that they overturned Roe. Thank you. I yield back.
Thank you, Senator. Our ranking member has returned from the vote, and I turn to him.
I apologize to some of our witnesses. I had to leave to go vote. Professor Sneed, I find your area of expertise and research to be very interesting. It seems to me there are two options, and if there are others, I hope you will school me. With respect to abortion, one option is to have a federal rule that applies to every American. Under the current status of the law, in order to have a federal rule, more likely than not, Congress would have to pass it. Or we would have to amend the Constitution, since the United States Supreme Court has ruled that abortion is not addressed in our Constitution. The second option, of course, is to let the American people decide on a state-by-state basis. There are at least two ways that people in a state can decide. One is through their elected representatives, the state legislature. The other is through a public referendum. Are there any other options other than those?
Well, not if the people are the ones doing the deciding. We saw for almost 50 years what happens when a court decides to constitutionalize the question and takes the matter away from the political sphere, in which one has to live with whatever that court decides. You could Roe v. Wade's one model. You could imagine another model in which a court imposes restrictions on abortion by virtue of interpreting whatever the constitution of that state or sovereign country happens to be. But if the people are to decide, it could either occur in the ways that you described, namely through the federal political branches. Now, there's an interesting question about what the scope of Congress's authority is to regulate the practice of medicine in the states. You'd have to find an enumerated power. Maybe it's the commerce power or something like that. But it's not an obvious source of authority in the Constitution to regulate the plenary authority of the states and override their decisions to regulate the practice of medicine. So what we see most often is the states themselves pursuing as what's been described as a patchwork, whatever is consistent with the values of the people of that state, whether it be through their representatives or through by direct referendum.
Let me ask you this, because I'm particularly interested in your analysis of this tough issue from an ethics perspective. Some of my colleagues believe, and indeed in my opening statement I alluded to some legislation that some of my colleagues are supporting. They believe that we should have a federal rule that applies to every American that says it is solely the right of the mother. The mother has the unfettered discretion to decide when, if ever, to undergo an abortion. What ethical considerations does that present?
Well, the principal ethical question that is that is under consideration in this whole context is how do the various competing goods relate to one another? I've heard a lot of folks talk about the goods of autonomy and freedom and the pursuit of well-being and healthcare on the one hand. Others.
Let me put it another way. Excuse me
Yes.
for interrupting. I was maybe a little abstract. Let's suppose that a mother presents at 34 weeks and says, clearly past the point of viability for the child, and says, I have decided I don't want to have this baby. If I'm being honest, I don't want to have this baby. And it is going to cause me enormous emotional distress to have this child. I'm just not ready. And she's sincere. She's really thought about it and said, I'm just not prepared to have this child, and it will affect me emotionally. And I want an abortion. What are the ethical considerations presented by that situation as opposed to the ethical considerations, if any, presented by an abortion within the first 6 weeks of a pregnancy?
Well, I would say that the principal ethical question when you're talking about what it sounds like you're describing, legally speaking, would be termed an elective abortion, not an abortion necessary to preserve a woman's life or health. And that is principally, incidentally, that is principally what the social science evidence suggests. Late-term abortions are principally for situational, circumstantial reasons, not for instances of health and safety or even fetal abnormality, according to experts like Warren Hearn and other social science studies that have been undertaken. But the principal ethical question in any of these instances is, what is the moral, ontological, and legal status of the unborn child? What you're talking about is the proposal to take the life of an independent human being for the sake of the goods that you are describing, that to preserve emotional well-being, to preserve a woman's mental peace or her socioeconomic peace. That's the ethical question. That's what's so, in some ways, impoverished about our public debate. We hear one side talking about one aspect of the issue, the goods of autonomy and healthcare and so on, and the other side talking about the ontological, biological, and moral status of the unborn child, but the talking is going past one another. No one is, as far as I can tell, engaging all of the different dimensions of the debate, which I think is essential for wise and humane self-governance. No matter what your position on abortion is, you should at least take seriously the other side's perspective. And that's what's missing, I think, from our public debate. And I'm not talking about my colleagues here on the dais, but our public debate would benefit from a more comprehensive conversation about what the competing goods are.
With my chair's permission, I'm going to see if anyone else wants to weigh on this. Let me present the situation again, because this is a tough case. A situation where 34th week, the mother says, I've decided I don't want to have this baby. And it will affect me emotionally. I just don't want the child. Should the mother, at that juncture, have the right, clearly a viable child, to abort the child? And who should make that decision? And how do you represent the child's interest at that point? Who represents the child's interest at that point? Now, that's a tough question. Would anybody else like to weigh into that, on that? Mr. Mato? My eyes are terrible.
Mr. Mato-Zimmet.
Mr. Mato-Zimmet?
With all due respect, I don't think these kinds of hypotheticals really
Yeah,
reflect...
don't tell me that.
I don't think they reflect the reality of abortion care in this country.
You just dodged the question.
I don't think that there's a point...
That's what...
This is actually get to answer the question.
That's what your side always says. Now, that's not my example's not unrealistic.
I think that
if your answer, I want to save my time. If your answer is going to be that never happens, let me go to Ms. Fry. What do you think?
Well, Senator, first of all, if you don't ask a question if you don't want to know the answer, and I think 1%. But I'm saying to you, Senator, 1% of abortions happen at 21 weeks or later. Mm-hmm. So I think the premise of your question sets up a conversation about abortion that is unfair. It is rarely is that ever the instance. The vast majority of pregnancies and abortions that are considered late in a pregnancy have to do with severe, devastating medical circumstances. And I understand your point, Senator. I understand your point. But with all due respect, I also think the chances of people sort of getting all the way through a pregnancy and just sort of saying, I don't want it, is disrespectful to women.
Well,
the majority of
if
women
that's
who are
the
getting
case,
abortions
then
are
why wouldn't
already
we-
mothers,
If that's
Senator.
the case,
They respect
I don't
their
wanna argue with
kids.
you. I'm really trying to have a discussion. But that is the alternative I presented is very realistic. I'm not saying it happens 1,000 times today, but that's where the rubber meets the road. And the answer I always get is, well, that never happens. Well, you don't know that, and I don't know that.
But I think the
And
difference,
what
what I
I'm
would
saying-
say, Senator,
what I'm
is
saying
making a
is- let me
rule.
finish my thought. What I'm saying is, if it's not a problem, then why wouldn't we make everybody happy by saying, I'm not recommending this, I'm asking the question. Then why wouldn't we just say, okay, if you say it's not a problem, then what's the problem with saying after a certain number of weeks you can't have an abortion? Let me talk to Dr. Scott. You heard my example, okay?
We're now well into Senator Blumenthal's time.
Oh,
so
I'm sorry.
wrap up at your time.
Can I get the doctor's answer? I didn't see Dick come in, I'm sorry.
Well, I would just say that we don't keep very close eye on what's going on in the abortion industry in this country. There are at least 5 abortion facilities that have no gestational limits on the abortions that they will do. So they will do an abortion on request. The woman that you described clearly needs mental health counseling. She clearly needs support. It is highly likely she is being coerced into that decision. The data that we have on late abortions,
But what
again,
if she's not? What if she is honestly...
You're really into Senator Blumenthal's time now. You can have the witness answer the question, but then it's not your time any longer.
What if she's not? What if she hadn't been coerced?
This is
Not your
quite-
time any longer.
this-
Let her finish, and I'll recognize Senator Blumenthal.
This is quite a dangerous abortion for her, and that child is definitely capable of feeling pain as he is dismembered. So as a moral society, we should absolutely say no. We're not going to let that opportunity for that late abortion to happen, and we should be willing to set some limits.
Senator Blumenthal's recognized.
Thank you, Doctor, very much.
Thank you. I apologize, Senator Kennedy, for interrupting.
No, I'm sorry I went over. I didn't
But
see you
thank you,
come in.
Mr. Chairman, for giving me this opportunity.
I didn't see you come in. I
to
apologize.
ask a couple of questions. And I want to reframe the conversation a little bit and have a little lawyer talk here. Ms. Fry, it's been a while since I was in law school, but the right to travel strikes me as really one of those bedrock principles of our republic. And the reason is, of course, that we began as a collection of states that thought themselves sovereign, and they were ready and willing to impose all kinds of restrictions on citizens of the United States to make judgments about different currencies, different religions, different purposes of travel, to make judgments about who could travel and not. And the right to travel was fundamental to the founding of the United States of America. And it seems to me the essence of that right is that we don't judge the reasons that people want to go from one state to another. Now, of course, traveling across state lines provides jurisdictional basis for prosecuting certain kinds of crime, kidnapping, for example. So there are a number of reasons why traveling across state lines is important, but the constitutionality of the right to travel seems fundamental. So maybe you can speak about the constitutionality of restricting the right to travel just because it is for purposes that may evoke disapproval. They may seem immoral. And maybe they're illegal, so they can be prosecuted as a basis for some other crime. But the right to travel seems fundamental. Am I wrong in thinking that way?
No, Senator, you're absolutely right. I mean, the right to travel is one of the bedrock sort of foundational principles of our nation. And in fact, as I'm sure you remember back from law school, it predates the Constitution. The ability to freely travel between the states is found in the Articles of Confederation. And it really informs the right to travel in a couple of different places in the Constitution itself. It's a basic right of citizenship. And I think even in the Dobbs decision and the concurrence from Justice Kavanaugh, he explicitly says that the right to travel is constitutional. So I think, to take the flip side of your question, efforts to really impede the right to travel really go to the heart of our Constitution and our democracy. And even in a world where people disagree on a lot of things, our ability to go from state to state and sort of our own accord is a fundamental principle.
I'm curious, do any of the other witnesses disagree with anything that Ms. Fry or I have just said? I take it not. You're in agreement on that point. So let me pursue the next question. Why should the right to travel be codified in statute, regardless of the unconstitutionality of state laws restricting the right to travel? Why is that important?
Well, I think, in a moment where there's a lot of uncertainty and where you see states intentionally trying to restrict travel, I think that Congress has an important role to play in being very clear that this is a fundamental right. And so even though it is very much grounded in our Constitution and there's strong Supreme Court precedent that says that, I think Congress speaking with one voice, being clear that this is a fundamental protection for all people, is something that's important to do.
What I hear you saying, and I was in the state legislature in Connecticut for 6 years, so there's no intent to criticize here, but a lot of state legislatures may simply not know a lot of constitutional law. And they may be unaware of its importance, and they may do things that are unconstitutional. But then someone has to go to court to litigate it, and this statute gives a kind of legal lodestar so that state legislatures won't do unconstitutional things. Am I putting it roughly correctly?
Yes, I completely agree with you, Senator.
Thank you. I'm out of time. This conversation is immensely important. I thank you, Mr. Chairman, for having this hearing.
Thank you, Senator Blumenthal. Senator Lee.
Thanks so much, Mr. Chairman. Curious about the title of this hearing. The title of the hearing is Abortion Bans and Interstate Travel for Care After Dobbs. This seems like an attempt to mislead, seriously mislead the American people into thinking that one or more states are out there criminalizing or otherwise utilizing the coercive force of the state to prohibit travel to obtain an abortion in another state. I'm not aware of a single state that's doing that. Not one. I'm not aware of a single state that's planning to do it. Now, the only thing I can think of that it could relate to is minors, the transportation of minors, underage children, across state lines in order to get an abortion, which leads me to wonder whether this is really just about the sort of the pro-abortion activist community and lobby wanting to allow traffickers and abusers and abortion providers to transport children across state lines without their parents' knowledge or consent in order to get an abortion. It's a violation of basic standards of decency. It's a violation of parental rights in order to do this. But this is not what the title of the hearing seems to suggest, which is that states are out there criminalizing interstate travel by a woman who wants to get an abortion in another state. Not one state is doing that. Not one state is considering legislation to do that. Now, don't just take my word for it on this, on what this is really about. That is the interstate transportation of minors, of children, without their parents' knowledge or consent so that they can get an abortion. Planned Parenthood employees have themselves confirmed it. An adult male working undercover as an investigator with Project Veritas in Missouri told Planned Parenthood employees that he was seeking an abortion for a 13-year-old girl without her parents' knowledge or consent. According to court filings, after acknowledging that the abortion would be illegal in that circumstance in Missouri, the Planned Parenthood employees offered to help transport this 13-year-old girl to another Planned Parenthood in Kansas, assuring the man that the parents would not find out. They would never know. The managing director said, quote, "We never tell parents anything. She's an adult in our clinics," close quote. She's 13. When the reporter asked how to transport the 13-year-old girl to Kansas for an abortion, the managing director said that this was, quote, "not their first rodeo. They're going to know exactly how to handle that," close quote. The managing director went so far as to write a doctor's note to the child's school saying, quote, "We can cut off our letterhead so it doesn't even say where the child's going," and offered to arrange transportation for the child, get the child to Kansas, and even pay for the abortion, lodging, and other services so that the 13-year-old girl could undergo an abortion, a significant surgical medical procedure, one that in some circumstances can present complications that themselves can be life-threatening, all without her parents' knowledge or consent. This is appalling. Dr. Skup, do you believe it's ethical to conduct an elective, non-emergency surgical procedure of any kind on a minor, on a child, without notifying and, in fact, without notifying and obtaining the consent of the parents, and in fact actively concealing the fact from the parents that the procedure is happening?
No, it's a bedrock standard of medical care that we do not commit a procedure of any type upon a minor. They are not felt to be able to give informed consent by themselves, and we do need the parents' consent.
Okay. Now, how dangerous? So it's not just any adult that needs to consent. It needs to be the parent, unless parental rights have been terminated or something like that, right?
Yeah, if there's a legal guardian.
Right. Now, how dangerous is it to conceal a surgical procedure, perhaps an abortion, for example, from parents, the parents of a teenage girl who might experience complications from the abortion?
In this particular instance, every person, I believe, in this room would want to know if their child was in that sort of a circumstance and be able to come alongside their child to provide support. This child needs mental health care. We don't know who the abuser is. Is it someone in that family? Does this child need to be removed from that family? This needs to be reported to Child Protective Services, to law enforcement. As a civil society, we should want whoever impregnated that girl, which is by definition statutory rape, to be prosecuted. We should want to stop this from ever occurring. The abortion will not fix the girl. It will not restore her innocence. It will merely add trauma to trauma. And we know that mental health complications are quite frequent, particularly in this sort of a situation.
And particularly if her parents don't know what happened and she experiences complications, that could be a problem. Now, I was shocked to read the story that you linked in your testimony of an Idaho woman and her adult son were charged with kidnapping his 15-year-old girlfriend when they forced her to travel to Oregon for an abortion without her parents' permission. The son has also been charged with rape of a minor and producing sexually explicit material involving a minor. Are these the type of people who some at this hearing want to protect with their opposition to parental notification laws?
We hear so much discussion about this heartbreaking situation, and yet in the same, when we turn the page and see that there are those who are willing to facilitate the transport of these minors without their parents, we recognize that that's being used as a tool, that there's really very little care for that child in that tragic situation.
Mr. Chairman, I've got one small follow-up question, if I could ask one more.
Sure, go ahead.
Thank you.
Of course.
Professor Sneed, tell me what the Supreme Court held in Troxell versus Granville regarding parental rights and how that might apply here. to the transportation of a minor to another state without the parent's knowledge or consent for the child to undergo a major surgical procedure, one that in many circumstances can carry substantial risks for the child's health.
It seems clear that that's not permissible under the relevant precedent.
And why is it not permissible? What is it that we know about parental rights from Troxel?
Parental rights are sacrosanct and essential, and they're essential bedrock principle of the rights that citizens of the United States, people in the United States, enjoy.
Thank you. Thank you, Mr. Chairman.
Thank you very much. I think what I'd like to do in closing is just let Ms. Miller finish describing the circumstances that she went through. Just to recap, you discovered you were having twins. You discovered that one of them would not survive the pregnancy. You discovered that that presented danger both to you and to the healthy twin. And you rather fatefully discovered that your medical team was unable to provide you certain information and to provide you certain medically indicated procedures because of their concern about law enforcement threats in Texas. So that's where we were. So now there you are with a team that isn't providing you all the information that you need. You're a little bit on your own, I suppose, you and your husband. What did you have to go through to discover and work your way through the steps that were able to get you to a safe place for the care that you needed?
It was grueling to go through that process, just completely blind. The best analogy I can give is that it felt like we were in a dark room, unable to see, and we're just feeling for a door, trying to find a way out. We're hearing a lot of opinions on abortion here, and none of them matter to the person who is a patient in that room and trying to navigate their own healthcare situation. And going through this process, I was not living a hypothetical. This was my reality. And my reality was that it was a devastating diagnosis. We were struggling to find information. We were lucky that we have lived out of state. My husband's from the Northeast. We knew people across the country who could give us information, who could help us out, who were willing to do so. That is not the reality for most Texans, for the millions of people across banned states. And as we went through this,
you had to create and contact an out-of-state network to get the information that you needed to get to safe health care.
Correct. One of my best friends is an OBGYN, and she fortunately knew a OBGYN in Colorado, in a safe state. And I'll never forget getting on the phone with him, and his first words were, "My feet are on the ground in Colorado. I can answer anything you ask."
So you decide to go to Colorado.
That's correct.
Describe the journey, who was with you, how it all felt.
It was terrifying to go through that process because we didn't know what these bans meant. That's the whole point, is to create this confusion, to sow doubt, to turn people against one another. And I remember going through the airport at Love Field, just staring down at the terrazzo tile, trying not to throw up. And I think I only made it through airport security on pure adrenaline. I got through, went up the escalators, and threw up in the first bathroom because I was still so sick. And I shouldn't have been doing that. I shouldn't have been standing in a security line when there was a basic healthcare procedure 3 miles from my house that was 15 minutes. And instead, we were going through this journey where 72 hours before I had left the emergency room. That's not healthcare.
How did it feel when the doors closed on the plane and you knew that you were on your way?
A bit like the movie Argo. It felt like any moment before we got on that plane, somebody might pull us out in the security line, in the line to get on the flight. And we finally lifted off. And when we got to Colorado, when my feet touched the ground there, I just felt this huge sense of relief.
And when did you first contact your medical team in Colorado? When did you first meet them?
That was the doctor I'd been in touch with who had answered my questions, and he had worked with me to get me in with their hospital there.
And so you went to the hospital and met the team there?
That's correct. Because it's a bit more technical procedure for the single fetal reduction, which is an abortion. It's an abortion of one twin. They had a person there who was better trained who could do that, and so it was important I see that doctor.
Yeah. And how were your feelings about the difference between the team that you knew and trusted in Texas, but were limited in their ability to provide you both information and health services, and this new team that presumably could tell you what you needed to know, be truthful and candid with you, and provide you the services that were medically indicated?
It was just a wildly different course of treatment to be able to actually get questions answered. I like all my doctors. I like nurses, et cetera. In Texas, I felt for them that their hands are tied in what they can do. And the team in Colorado was incredible. They were trying to do everything from help me just know what was going to happen with the procedure to following up afterwards with mental health resources, support groups for others who have been through my situation and who are now going back to these banned states where we are just silenced and we're erased.
And when did you come home to Texas?
So it's a bit shocking for a 15-minute procedure that could have been done 3 miles from my house. It took several $1,000s in 3 days. And the entire time we were in Colorado, we had clear blue skies, sun shining, and it was amazing. We touched down in Dallas again, and it was night. And it just felt once again, blackness had come over us. And we didn't tell anybody what had happened. We didn't tell anybody what we had done because we were so scared.
And your son, how's he doing?
He's great. He just started walking last week, so, once again, that's a terrifying situation, but a good terrifying.
Different kind of terrifying.
Exactly.
Great. Well, I really appreciate you being here. I know that this is not the easiest thing to talk about, and I'm grateful to you. I want to, without objection, put into the record a letter from Women and Infants Hospital, a hospital in Rhode Island that specializes in OBGYN and pregnancy and birth care and has for a long time, all the way back to when it was the Lying In Hospital. It's a regional treasure. A statement for the record from the American College of Obstetricians and Gynecologists. A letter from a group called If, When, How, Lawyering for Reproductive Justice, testimony by Elizabeth Leng, and a letter from Apiary for Practical Support. And I would also add to the record, given that Dr. Skop has testified here today, a decision, an order from Judge Cooper in the case Planned Parenthood of Southwest and Central Florida versus the state of Florida, which makes certain findings regarding the credibility and expertise of Dr. Skop that I think should be part of the record. With that, the hearing will come to its conclusion, and I would like when do we have 7 days? Okay. If questions for the record come in, we have 7 days for questions for the record? Statements for the record. Okay. Anybody wants to add anything to the record, they have 7 days to add it to the record. If you get questions for the record, I will ask that you turn around your response as timely as possible, ideally within a week. I think this has been a interesting excursion through a great number of hypotheticals and abstractions, grounded with the life experience of one Texan woman who has shown, I think, a lot of gumption and courage to see herself through that situation and home safe with her 2 children now, and willing to share the experience, because I think the granularity of that experience, the feelings that you went through, the things that you had to do, the money you had to spend, the fears you had to hold in your heart, the uncertainty you had to worry about when doctors couldn't provide you the information that they knew that they had to provide you but couldn't because of Texas law. All of that, I think, is the reality here. And we would not have that reality if it weren't for you. So thank you, and the hearing is adjourned.